Ha ke wa boele mo wa thamiso se ngwa tsatsi la ka jeno mo ile hore fela re tlo bua ka ditaba tsa lekala la bophelo. Recently, in the month of September, 2 virus hospitals, molecular laboratories available in Lesotho were officially opened by University Research Company together with the Minister of Health just after they went for refurbishment, namely Mafting and Motibang Hospital in the north and south region of the country. With us today we have Mr. Brad Kofi-Saki as URC Country Director, along with Mrs. Tsietso Mutwane from Minister of Health, to elaborate more on the project that commenced early in 2015. Melintate, welcome to Tamiso this morning.
Thank you, Dade.
Yeah, Ma'am Mutwane, can you briefly share with us about the project, strengthening laboratory diagnosis and monitoring scale up and improving having HIV care, the project that is running now?
Thank you, Dade. I'll just give a background that the project started in October 2009, and the first project for 5 years was to strengthen laboratory, meaning to improve quality of test results and also to capacitate our human resource in the ministry, both not just government laboratories but also child laboratories, which have a MoU with the Ministry of Health. And after the 5-year project ended, we had another application for funding opportunity with CDC PEPFAR, and we awarded that project, and URC was was awarded as our implementing partner to support us. In this second one, we really was looking at care and treatment mostly, but within the laboratory to try and also meet the UNAIDS 1990 targets, which were passed in 2014, which, as you know, that 90% of the population should know their status, and out of that 90 which know their status, 90% of them should be on treatment, and on those who are on treatment, 90% should be virally suppressed, and that's where we come in.
Okay.
All
right. Mr. Kofi, what exactly is the goal and overview of the project regarding, or what needs to be played by URC coming to this project?
Thank you, Mr. Thapelo. Like my CMTSO has rightly said, in 2015, URC bidded for a CDC project to implement what is strengthen the laboratory diagnosis and monitoring scale up in the Kingdom of Lesotho. And it was awarded on the 1st of April 2015, and it goes for another 5 years up to 31st of March 2020. What is the goal? The goal basically is to assist the Ministry of Health in implementing exactly what MTSO has actually elaborated. Because UNAIDS set a target in 2014, like she rightly said, that 90% of people should know their HIV status, 90% of those who know it should have a viral load, and then 90% of those who have their viral load should have their virus suppressed. So as URC, we came in to implement the project. There were a number of focus priority areas, which include the scale-up of the viral load and also scale-up of the early infant diagnosis. So that's exactly where we are. There are other components. There are a number of focus priority areas which I will actually allude to as we go on. So as part of that scale-up, which is the viral load, the reasons why we are here, we identified together with the ministry and of course CHAL, identify Mafeking and Motibang as the areas where we are supposed to actually set up another viral load laboratory. Prior to that, there was only one, which was at the National Health Laboratory, which means that all the samples in the country have to be transported to these. You can just imagine the logistic nightmare. So in 2016, 15th of September, together with the ministry, we worked tirelessly to establish the Mafeking Molecular Laboratory, which was commissioned by the then minister and then the Ambassador Harrington. Then that particular laboratory is meant to receive viral load specimens from 3 southern regions, which is Mafeking itself, Mohale's Hook, and Kuti. Then as soon as we were done with that, we started a project in Motibang, which is much more bigger, than what is in Mafete, because you know Leribe district is the second in terms of population, 300,000, and the prevalence you have already mentioned at 25%. So we started working towards that again. It took a bit of time, but like you saw on the 12th, that one was also successfully launched again by Ambassador Harrington and the new Minister of Health. So all this funding is coming from PEPFAR through CDC for us to implement. But we cannot do that without the support from them, because the Ministry of Health, the child, are our host, and we have to work together very well. So it just shows the collaborative efforts that has allowed us to at least establish these laboratories that are a key tool towards achieving the set targets.
Okay, those laboratories had been existing for some time. What was the situation by then before they can be refurbished? And what benefit will we get after?
As you mentioned, the laboratories have been existing there because they are part of the hospital setting.
Yes.
What we did, like Ndate Bright has already mentioned, we looked at the opportunity of using the available space. For instance, in Mafeteng, the waiting area for patients, that's the one we renovated to accommodate the molecular lab, and then created a different waiting area for patients. And also in Motibang, the corridor, which was used for just patients and public to move through between different wards, was also used to extend the laboratory so that we'll be able to make the molecular lab. So what was previously a reception area was moved from the existing laboratory into that walkway, and then it was enclosed, so that is the reception area. And then we created a different reception area for our patients. So, like he mentioned, the Motibang renovations it was a bigger task than Mafeteng, because the existing structure in Mafeteng just needed to be renovated, put the benching, and make sure that the platform, which is the viral load platform, will be able to be contained within the premises.
There are some targets anyway that had been placed before, especially going to 2020, with 25% of people living with HIV and
Yes.
AIDS, and with a population of slightly over 2 million.
Yes, sir.
Are you going to get towards this target that you're planning regarding 1990?
Yes, in 20, after we received the 1990 targets, the Ministry of Health developed a scale-up strategy for viral load. And within that strategy, that's where we identified that our regional laboratories should be also capacitated to be able to perform viral load. Like Ndate Bright has mentioned, prior 2016, it was only the National Reference Laboratory at Lebering near Queen Mamahato, which was performing viral load. And that means all viral loads which were coming or were requested needed to come to Maseru through our sample transport system. So within the laboratory, we have a tiered system where we are using our sample transporters, which are motorbikes, through the help of Riders for Health. Yes, but because of the huge influx, we realized in that strategy that we have to decentralize at least to the regional labs.
Kofi, do you have some projects that needs to be moved forward, or are you still working on after you have completed some of them?
Let me say this, this is a cooperative agreement, and there are specific targets that are set in a particular year.
Yes.
We apply every year to the funder to get permission to carry out certain activities.
Yes.
So as it is now, we as an implementing partner are not the ones that determine where we want to carry out this project. It's in fact is the ministry that determines where they want these particular laboratories to be. So as and when the ministry advises and requests, then we will sort the permission through the mechanisms and get a permission from PEPFAR to carry it out. So these two were the ones that were given to us. But I would say it's not only these, the viral load that we're doing. There are issues on quality, which is, as we said, the 390s. The first 90, which is the testing of patient, requires a certain component of quality. That's we call it the either the external quality control programs or the proficiency panel testing. And URC as a project is actually very much involved alongside the ministry and the child facilities. So we're talking about, in that particular instance, we're talking about 295 or 298 facilities, testing sites, and we facilitate that kind of program. We also alongside facilitate the issues of mentoring, laboratory mentoring, and on that note, there have been a number of training programs that have actually been conducted in the country to equip the in-country lab staff to be able to live up to that standard. Because the reason you do these things is that when you and I send our specimen, wherever it is, we want to make sure that whatever result is coming out is absolutely 100%. And those results will guide the clinicians in taking the right clinical decisions. So we are involved in that. Like I said, we are involved in training programs as well. Like Matthew so rightly mentioned, she mentioned the Riders for Health. Riders for Health are actually part of our, we subcontract them, they are sub-grantees, and within this PEPFAR priority district, the scale-up district that they call it, we're talking about Mafeking, Moalis Hook, Maseru, Leribe, and Berea. Yes, this ones. So we have 24 riders that are subcontracted, and they're transporting all the specimen up and down. So if I can just give you maybe a little bit of a rough data so that you can see. Let me just give you, for example, between 2015, April 2015 and June 2017, over 570,000 results have been delivered by these riders. Again, we have about 667,553 specimens that have been transported by these same riders, you get me? Okay, and then we have issues of what do you call it, quality management systems that are being implemented alongside the Ministry of Health staff. With our staff, we do have staff in Maluti, we have staff in Scott, we have staff in St. Joseph's. We have mentors that are actually working at Motebang to make sure that the quality standards are all increased. So in terms of the infrastructure, if I were to answer your question directly, this is what the ministry has agreed to now. This is what our funder has permitted us to do. And let me mention one important thing. So along these equipment that are currently in the country, there needed to be a certain reagents for them to run, and most of them are actually cold chain. So alongside the renovations that have taken place, we established a cold room in Mafeking. There are 2 cold rooms at the National Health Laboratory, and there is one currently that was added to Motebang. This is to ensure that at least there could be 6 months, minimum of 6 months, a continuous stock of these cold chain reagents that are needed to run the platform. So if all the chips are in place, obviously your earlier question as to whether these targets will be met, there's absolutely no doubt. Of course, people have to commit to it, people have to work the extra hours, but we need to understand that we all have debt to humanity that we have to pay, and that will be our contribution to not only Lesotho, but to Africa and to humanity.
Okay. Mamtane, Lesotho failed to perform well on certain MDGs anyway, if I may say, though we are talking about SDGs currently, which I believe all are being addressed in this project also. Do you think you're on the right track to achieve or do better than what you did in the past, especially as a Minister of Health?
Yes, Ndate. I think with the support we are getting, I was just going to let you know that even with the national targets, for instance, for viral load, when we developed the scale-up strategy, we started only the routine viral load. Remember, prior to June 2016, we were only doing viral load for only targeted groups. That means the under 5s, the pregnant and lactating mothers, people who were suspected that they are having a virological failure to the ARTs which are given. So, for instance, we indicated that the moment we moved to in June, we were able to achieve 86,000 tests, which we did, and yet our target was 80,000. And we are planning that by 2017, our target is to have 111,000 tests done. But also remember, with this, we are hoping that also our partners who are our clinical partners, that they align to the guidelines which were developed also in 2016. When I come to the SDGs,
Yes.
I'm hopeful with the interventions which are given. Remember, SDGs is not only on communicable diseases. We are also talking about other non-communicable diseases or other health threats. As you know, in Lesotho, we have very aggressive targets for maternal, to decrease maternal deaths. And through that, the Ministry of Health has gone an extra mile to ensure that we are decentralizing our services. You know, even through the Millennium Challenge, we had our health centers be renovated to make sure that we are able to provide maternal health issues. But when it comes to that, for communicable diseases, together with the HIV, also we have a problem of TB, and in Lesotho more than 70% we have co-infection of TB and HIV. So, but with the support of PEPFAR, which is supporting us mainly on HIV and TB co-infections, I'm sure we'll be able to reach those targets.
Okay, geographical location wasn't of impact towards what you want to achieve, because I'm asking this because some of these improvements have been done to urban areas, for instance, Mafting and Leribe, but we still have hard to reach areas. We're going to see some of our services improving, getting there towards those people on the hard to reach areas.
Yes, Ntate. For instance, through another partner, which is ECPAF, we have started rolling out a point of care, meaning testing patients as they come, point of care early infant diagnosis, which is also diagnosing HIV in infants, because we want to make sure that infants get treatment as early as possible to reduce the mortality. So that's another project which we are doing as Ministry of Health to ensure that we bring services right down to the facility level. So that has really seemed to work well. We have also, as you mentioned, as I mentioned, TB is also a problem. We are going to open 13 mini laboratories in the health centers, and these are targeting hard to reach areas like Bobede Clinic, Nohana, all those clinics which are really, in those days where we said you only go by PLAY, which is Lesotho Flying Doctors Service. So to make sure that patients are diagnosed on time and they are put on treatment on time to reverse the scourge of diseases.
Wrapping up our discussion with few minutes, Mr. Kofi, what would be your message to Lesotho regarding the project that you're working on?
Well, my message is very simple. The services are here. They are available to everyone. And thankfully, the government absorbed all the costs. So there is no need for anybody to actually stay back and die needlessly. If the laboratories are there, they are available to Lesotho. They should be able to take advantage of it and access the services, not only the viral laws, the TB services, because they are gene experts all scattered in the country, that will actually enable them to live a healthier life and take care of the children, so that we have a healthy nation. Because without a healthy nation, there can't be any development. And on that note, I want to take the opportunity actually, as URC, a university research company, to thank the government of Lesotho for actually hosting us and giving us the opportunity to implement the program. I will very much also want to thank the Center for Disease Control for awarding the project to us, and I want to thank PEPFAR for actually availing the money. Not forgetting CHAL, which has the 40% of the facilities in the country. So together, like we said, we can actually roll back these disease and get a healthy nation, hopefully. Because as you know, the treatment is being used as a tool of prevention. So the more people have their viral, what do you call it, viral load suppressed, the unlikely it is for them to transmit the disease to the partner. And if you look at the 2014 health data, it talks about 20% of maybe discordant couples. In other words, there are people, the couples that are living, one is positive, one is negative. So with this sort of treatments available, the likelihood that the other partner will be infected is almost a minimum. So that would be my.
Yes, actually they have indicated that there's 93% reduction in HIV transmission for serodiscordant, meaning one partner of the couple positive and one negative. If they are virally suppressed, it has been proven that 93% of patients, they don't transmit the disease.
Oh, thank you very much for your time, Mr. Kofi and Mayor Mutshwane. Wish you all the best on the work that you're doing.
Thank you, Dad.